Hi everyone, I'm Dr. Mike Gorman and I'm here today to talk to you about fibromyalgia. First thing I want to say is the concept of fibromyalgia is like a lot of concepts that are coming down the chain in the healthcare industry right now. They're literally making up names in an attempt to try to figure out what do we do about some of these conditions. Medicine's very, very good at life-saving, heroic care, and they're very good at things that require emergency care, ICU units, ER, things like that. But otherwise, they're not very good, and that's because they're not addressing the cause or the causes, which is kind of what we're experts in. Now, let's take a look at fibromyalgia. Let's break it down. Fibro means joint, mya means muscle, algia means pain. So they put it together, they make it these fancy words. Here's where it's really scary for you, the patient or the person that has it. You hear I have fibromyalgia, you now think you have this condition that there's nothing that you can do about it. The reality is there's nothing they can do about it, meaning the traditional medical system. Their options are to give you drugs which do not work, and if they do, they're only going to give you temporary relief and mask and cover up the symptoms. Or they can do different types of surgeries which don't typically fit for fibromyalgia. So it's not always that there's not a solution, it's that there's not a solution that fits into that particular arena, the healthcare arena. So what's our approach to that? Well, our approach to everything is threefold. We look at the body from a holistic perspective. We look at it physically, we look at it biochemically, we look at it psychologically, okay? Let's break that down into some cases we've seen recently in fibromyalgia. We look at things like chiropractic for reducing pain, getting the spine, getting the body moving better, the muscles moving better, things like massage therapy to help work on the muscles. But why do we have widespread pain in the first place? A lot of that has to do with our traditional lifestyle, which we can support you with. It also has to do with toxicity. We live in the most toxic time in history right now. So it's not a question of are you toxic, it's a question of how toxic are you. If I ask my patients, I say, how many cleanses and detoxes do you do a year? If they say, what's that? You're either moderately toxic or severely toxic. It's not a question of are you. And so where do these toxins go? They've got nowhere to go. They tend to go into the muscles because your body tries to take it from the tissues. It doesn't want it to go in the blood. It doesn't want it to go to the important vital organs and the brain. So it ends up taking these toxins, putting them in the muscles. Then we get severely inflamed, severe pain, and severe restrictions of range of motion and stiffness and all these other things that many times we associate with things like old age. It's got nothing to do with that. It's that these toxins are building, why we're malnourished, why we're not getting enough vitamins, minerals, and things from our diet. We're eating genetically modified foods, which our body can't absorb and utilize. So there's this big we're being bombarded by all of these different things all at the same time. And if we don't address all of them, at least on some level at the same time, we're not going to get results. The crazy thing is if they do give certain medications, medications are stressing your liver and kidneys that are already bombarded and overstressed by all of the toxins and all the other things that are going on in your body. Last but not least, there's a lot of different things and a lot of studies out there with what we call mind-body medicine. So our emotions are literally in our body, and I'll talk more about that on other videos, but we carry stress in our body, and we all know it if we really check in with ourselves. If you're really stressed, you don't feel it here, right? Where do you feel your stress? You feel it in your chest. You feel it in your gut. You have trouble digesting food, right? You feel it in a stressful day. You feel it up in here. So we know it's not a crazy notion that we carry stress in our body. But what we want to do is we want to evaluate things physically. We want to evaluate things nutritionally, evaluate you for toxins. There's lab tests and different things, very scientific, that we can do. We don't have to guess. We do specific lab tests, different things to measure all that stuff so we know exactly what to do. And then give you very specific nutrients and different things, lifestyle recommendations, specific diets for you, things like that. And then we have specific ways that we handle stress. In particular, there's a technique that we're board certified in called neuro-emotional technique. But there's a number of different things with health coaching and lifestyle coaching and things that we do to support you. So With fibromyalgia, you do not need to suffer with that, but you need a holistic approach. One of the last examples I'll leave you with something complicated like fibromyalgia is sometimes patients come in and they say, I've had this condition for 1, 2, 5, 10 years, whether it's the fibromyalgia or any condition. And then they say, I'm looking for the cause. Once you've had a condition over a year, there are now multiple causes. So think of it like a domino. If you're looking for the one domino that started hitting the rest of the dominoes and knocking them all down, that's wonderful if we can identify that. But once you've knocked 5, 6, 7, 8 dominoes down, you've got to pick them all back up. And that's really what we try to do with our holistic approach. If you miss any of them, then the body doesn't have what it needs to heal, and it doesn't heal and correct for long-lasting relief at a deep level. So for more information on that or anything else, please visit our website, www.gorman-health.com.